Being a home nurse is a difficult task, especially if you don't have enough knowledge about it. Here's a tip on how you'll treat your patients right. A sick person tends to be bedridden. In other words, he or she should rest and relax in order to regain their strength. For those people who are unable to get up or use the regular bathroom, a bedpan is used as a replacement for the regular bathroom. Here are the things you'll need when giving and removing the bedpan. First one, we have the bedpan. Second one, toilet papers. Then, washed clothes, the disposable gloves, and of course, towels. Let's move on how we'll give the bedpan. Here's a step-by-step method that you could follow. Step 1. Explain to the person that you are going to help him use the bedpan. This can erase any fear or uncertainty he may have. Step 2. Reduce the pillow to the lowest position tolerated by the patient. The closer the bed is to flat, the easier it will be to roll the person to his side. Step 3. Put on disposable gloves. Step 4. Ask the person what side he is more comfortable to rolling to. Roll him. Step 5. Place the bedpan against the buttocks, ensuring that the curved edge of the bedpan is under the buttocks. This will be the part of the bedpan that looks lower in size than the other. Step 6. Ask the patient to roll back, ensuring that the bedpan stays in place by keeping your hands on the bedpan until the patient is almost completely rolled back over. Step 7. Elevate the person's head on the bed slightly into more of a sitting position. This may make it easier for him to relieve himself. Step 8. Give the patient a privacy. Make sure he has a means of contacting or calling you when he's finished. To remove the bedpan, here are the steps. Step 1. Lower the head of the bed to a flat position if possible. Step 2. Ask the person to roll over to remove the bedpan. Step 3. Grab the bedpan with one hand and carefully remove it from the person's buttocks. Step 4. Place the bedpan on a chair and place a towel over the contents of the bedpan. Never place the bedpan on a side table or bed table. Step 5. Cleanse the person's buttocks or genital area first with toilet paper. If you are measuring the amount of urine, do not place the toilet paper in the bedpan. If the person has had a bowel movement, use a washcloth and towel to clean the area using the appropriate cleansing methods. Here are some tips and warnings that could help you be a good home nurse. First, always inform the patient on what you are doing. Second, never leave a person who may be confused. You can still give privacy to the person without compromising his safety. And the last one, never leave a person on a bedpan for an extended period of time. This may lead to skin breakdown.
I'm Lawrence Anthony S. Sumayo, the patient.
And I'm Timothy Jairus M. Perdon as home nurse. Good.
A massage can be an excellent way to relieve stress and relax muscles. It can also be a way to soothe somebody who is under the weather. It will be a nice way to pamper your loved one when he or she is sick. Here are the materials: lotion, powder, or alcohol. You can use any of these when giving a back rub. Moving on, here are the steps. Step 1. Make the patient lie on his stomach. He should be washed, dried, and warmed. Step 2. Remove the patient's clothes. Disinfect your hand using an alcohol. Step 3. Use oil or lotion when massaging somebody who is sick. This serves two purposes. It will feel very nice to the sick person and it will rehydrate the skin. When we're sick, we tend to be dehydrated. So this will help to rehydrate. Step 4. Spread lotion either on hands or directly on patient's back. Step 5. Spread the lotion equally on the patient's back. Step 6. Using the palms, gently rub the neck going down the buttocks area. Step 7. Put powder directly on the patient's back, spreading it equally. This will make the patient feel refreshed. Step 8. Roll the patient back on his position. Step 9. Put the shirt of the patient back. Here are some tips and warnings that I can offer you in giving a back rub. First, you shouldn't use much pressure in massaging. It will relax and soothe the sick person. Areas with bed sores and rashes should not be rubbed. Second, thoroughly wash hands after massaging. You don't want to be the next person to be ill, right?
I am Joe Abisamis, the patient.
And I am Kent Irving C. Ismael as the home nurse.